NeuroMotor Pen is a 21st century diagnostic. It's a digital biomarker for Parkinson's disease. It's the most accurate device available for the quantification of fine motor skill, and it has been clinically validated for the differential diagnosis of Parkinson's disease.
A quarter to a fifth of the patients that we get referred, it's really quite difficult to make the diagnosis. There are people who we've got straightforward Parkinson's and we can make the diagnosis. There are people who we obviously haven't got Parkinson's, so we can make that diagnosis or say that they haven't got Parkinson's. But then there are definitely a group where we're not quite sure. So the tremor might be bilateral, it might be a different tremor from what we normally expect. And there might be other signs and symptoms that might suggest another diagnosis. The DAT scan is a radioactive ligand is injected into the patient, and then the patient's left for 4 hours, and then they take a picture which shows the uptake in the basal ganglia, which is the movement centre in the brain.
I had to wait around the hospital area for a few hours until that took effect. I had to stay away from my 2 young children at the time when I started being sick. Don't know what that was. So I can imagine anyone being quite worried about the concept, not knowing what to expect. So it wasn't a pleasant experience.
DAT scans are quite expensive. It's quite time consuming, so the cost is something in the region of £1,000.
If there was any way of catching those early signs instead of going through the current method, which is the DAT scan, then I think more people would be happy to get that kind of diagnosis.